Could you explain the difference between, could you explain tolerance, and is chemical dependence different from addiction? And I know we've touched on this a couple of times already, but since it came up as a question, let's get at it once again, please.
Okay, so explaining tolerance is, there's sort of two ways that we look at somebody becoming physically dependent. One is through the development of tolerance, meaning that you need to take more of the drug to get the same effect, or if you take the same amount of drug, you get less effect. So that's sort of the definition of tolerance. Chemical dependence, it really depends, and terminology in this field can be quite problematic because in psychiatric terms, the DSM-4, which is sort of a diagnostic manual for psychiatric disorders, currently defines two substance use disorders. One is substance abuse and one is substance dependence. But the substance dependence, or opioid dependence, really means addiction, and where the physical dependence is only part of that diagnostic scheme. So chemical dependence, I would say, doesn't necessarily have a specific definition. People use it differently. When they say that, they may mean physical dependence or they may mean addiction. And so it becomes very confusing when you're talking about a prescription drug. And terminology is quite difficult in this field. What does misuse mean? What does abuse mean? What does chemical dependence mean? Psychological dependence, addiction. It's sort of fraught with inconsistencies. So chemical dependence sort of means what whoever's using it, how they mean. And so that's when we're talking about an actual psychiatric diagnosis, the term addiction is actually dependent. So it gets very confusing, and we're hoping that that in the field can be cleared up. But right now, there's no set definition.
One of the things that people are working on are brain imaging techniques to try to identify what is actually occurring in certain patients. Where are drugs working, which parts of the brain are being stimulated. You sometimes see the same thing in patients with diabetes who have progressively increasing insulin requirements, for example, or patients whose blood pressure is progressively more difficult to control. There's definitely, the body adapts to things around it by resisting some stimuli, at least in some cases. So if you present the body with something, it will try to reject it at some levels, and not all the time, and everybody is different. But your body tries to protect itself. That's really quite interesting, the way that works.